If you feel professional burnout, you are far from alone. A new survey from Mental Health American found 70% of the current workforce is searching for a new job, and 50% are checked out altogether. Doctors under the most stress, but teachers, law enforcement officers, and social workers are certainly close behind. And joining me now with how to identify and then manage that burnout is Dr. Clark Gaither with the North Carolina Professional Health Programs, NCPHP, which I have just learned is this really, really wonderful resource for those who are not aware of NCPHP. Tell us what you all do there.
Yes, we were created in 1988 by the North Carolina Medical Society and the North Carolina Medical Board to assist troubled providers. And those are providers that found themselves with an issue with alcohol or drugs or other self-destructive behaviors. Since we began, we've also taken on pharmacists and veterinarians. So we see all those professionals and try to figure out what kind of problems they're having and get them the help that they need so we can get them back to doing what they do best, which is taking care of patients.
And we hear that often, that it's the people who are taking care of everyone else tend to not think and care about themselves and take care of themselves, and that's why this resource is so important. Were you seeing specifically that those physicians and other folks in the medical field were dealing with burnout?
Absolutely. The rates of burnout in healthcare are very high and still climbing. And it's not just healthcare, it's other frontline professions like teachers and lawyers and social workers, firefighters, police officers. All those folks are seeing high rates of burnout. Anywhere the emotional impact is high and the pace is rapid, there is a risk of burnout.
All right, let's talk about how burnout manifests itself. Is it in your behavior? How are you seeing it? How can you identify the symptoms yourself?
There are three principal symptoms or hallmarks of burnout. The first is emotional exhaustion. That's where you come to feel like you can no longer give of yourself on an emotional or psychological level to the patient, the client, or the customer. The second is depersonalization, and that's the development of cynicism and detachment. You begin to detach from those you serve and what you do. And the last is a lack of a sense of personal accomplishment, and that's when you come to feel like what you do no longer makes a difference either to the people you serve or to yourself.
And what distinguishes burnout, you say, is it's emotional. It manifests itself in an emotional way, not through stress. Can you explain that distinction? Because I think that is fascinating. As someone who works incredibly hard and does not think enough about slowing down, I understand that concept.
Right. Well, the drivers or the difference between burnout and stress are many and varied. Now, if you're burned out, I promise you're stressed, but you can be stressed without being burned out. With stress, the damage is primarily physical. With burnout, the damage is primarily emotional.
Okay, so by physical, you're tired, you know, you're exhausted, you need some sleep, maybe your body's sore.
Well, with stress, it produces a sense of urgency and hyperactivity. You know, you're on alert, you're running around trying to stomp out fires and get things done.
Gotcha.
With burnout, it presents as detachment, and people get a sense of hopelessness and helplessness. So the damage there is primarily emotional. So if you treat stress like it was burnout or burnout like it was stress, you really haven't treated the underlying causes or drivers of burnout.
Fascinating. So let's talk about that detachment and how we can treat it. What can we do as individuals, and when do we maybe need to seek some help elsewhere?
Well, only 10% of the time does the individual burn themselves out. It's usually through workaholism or a life out of balance. They're not taking care of themselves in the physical realm. They're not exercising. They're not eating right. They're not getting enough rest. They work too much. Also, the development of an addiction obviously can burn someone out fairly quickly through drugs or alcohol or some other self-destructive behavior. 90% of the time, burnout is caused by the work environment, a toxic work environment where there's work overload, lack of control, insufficient reward, breakdown of community, absence of fairness, and conflicting values. Those six domains are the drivers of burnout.
Okay, so what do you do about it?
Well, if you have a progressive, forward-thinking organization, you can go to them and say, hey, I think we can do better in terms of some of these domains. How would you like to increase efficiencies? How would you like to decrease absenteeism? How would you like to decrease employee complaints and customer complaints? I think we've got a way to do that, and that's by looking at this thing we call burnout and then trying to come up with some plans or procedures or policies that lessen the impact in those 6 areas that I just mentioned.
If you don't have a progressive organization, you leave.
You know, you have a tough decision to make,
right,
because you can put your head down and grind away for years in a job you hate, but you will end up bitter, angry, and resentful.
Dr. Gaither, thank you so much for that information. That was certainly helpful, and I'm sure it helped somebody at home.
Well, thank you, and thank WRAL for shining a light on this subject.
Absolutely. We'll be right back.